All right, welcome to Quiver Financial's Healthcare and Retirement. I'm Colby McFadden. I'm joined with my colleague, Justin Singletary. Justin, welcome. How are you, sir?
Doing well. Thank you.
Good. It was good to see you. So, everybody, this is a presentation about healthcare planning for retirement. We're going to cover all kinds of topics from Medicare, the different parts of Medicare, to shopping for Medicare supplement plans versus Medicare Advantage Plan C, as many people will talk about it. We'll talk a little bit about the need for long-term care insurance, and we'll talk a lot about just the expenses that you could see during retirement and why it's so important to plan ahead within your finances. Because over the last 25 years that Justin and I have worked with different clients, the one big bogey that we've seen in their financial planning and their expenses is their medical care costs. So if we can plan ahead and we can do the right things in advance of a lot of the needs, we can end up saving ourselves a lot of money, and helping our savings last a lot longer. So that's always the big fear, is we don't want to outlive our savings. If you are somebody who is tech savvy and you are able to snap a picture of this, you're welcome to the slides. Anybody who is in attendance is going to get the replay and the slides as well. There'll be a few follow-up items where you'll be getting in your email, which is a one-pager on Medicare. It'll be the slides plus some additional information that we sent out to you as follow-up to this presentation. But you're all, if you got a QR code, you're welcome to follow along or zap it and watch it later. For anybody who's new to getting to know Quiver, we've recently acquired another advisor's practice by the name of Linda Wimsat. So we have quite a few of her new clients on board, and a lot of them are getting to know who we are as a firm. And plus, we have a lot of people who just are always checking us out from all the marketing that we do. So here's a little background. Our office manager, Laurel Donahue, has been running our back office for over 10 years. Patrick Moorhead heads up all of our due diligence and does a lot of work on our alternative investments. Justin Singletary, who's joining us today, heads up a lot of our business owner initiatives and 401k initiatives. And he's been just by my side over the last 6 years and has seen the business grow. And then myself, Colby McFadden, the CEO and Chief Investment Officer of Quiver Financial. So this team, plus quite a few partners, is what helps our clients manage their portfolios. And just one last little thing about Quiver Financial. What do? We make our bread and butter really with retirement investment management, also financial planning. We have in our office, people who can help you do trust preparation and estate planning. Within our Quiver of network, we have life insurance and asset protection specialists. And then we also do a lot of 401k rollovers and 401k design, which is usually headed up by Justin. So Justin, give everybody a big smile. Let them know you're the business guy, right? All right, so let's get into the presentation. Oh, wait, one more thing. If you would please, all of you, if you could subscribe to our YouTube channel, that'd be great. If you happen to be on Twitter and LinkedIn, connect with us there. If you really want to follow the presentations that we put out, especially what we start to do in March and later in the year around our market cycles and what's going on in the stock market and interest rates, then watch our website and join our newsletter. That's the best way to stay up to date on the information that we're putting out, especially as we get deeper into the year and talk more about finance and investing in markets. So quiverfinancial.com. So Justin, healthcare planning. So this is the thing, why, the first question we always kind of ask is, why is it important? Like, why are we even talking about planning in healthcare during retirement? And the reality is here's the big factors of why people do this, is that nothing changes more in your life as you age than your health. I'm in my 50s, and I can tell you, since I started my 50s, I can see all kinds of changes happening. And then in addition to that, you got family history. So family history can and probably will have a pretty big effect on what we end up spending on long-term care and what kind of medical services that we may need later in life. So planning is really around recognizing that there's these changing needs in our life, and that we're going to have to address them at some point. The big part of this, though, is trying to create financial protection. At the end of the day, you do healthcare planning because you're trying to protect the assets that you have or the savings that you have, because you don't want all of it to go to the hospital or to doctors or to prescriptions or things of that nature. And then another big thing is you want access to quality care. There's nothing worse or nothing more stressful than making hard decisions around quality of care when you're already under stress. So planning really helps just reduce stress at a time that you really need to create answers. And then the big thing is that over time, as we all age, we all need to be prepared for long-term care. Whether that is you've got enough savings and investment to self-fund your long-term care, or you have to use insurance or other programs that we're going to talk about towards the end of this presentation, little what we call life hacks, different things that you can do within your investment portfolios to help you prepare for long-term costs and care that could happen to you in life. So that's what we're going to talk about today. Is really all these things and why we want to plan around them. The big reason why we're looking to plan is this. According to Fidelity, the average retired couple age 65 in 2023, so that was last year, right, Justin?
Yeah, I think so.
Yeah. So, they may need $315,000, and that's after tax. So, Justin, if somebody needs $315,000 after tax, how much do you think they need before tax for potential health care?
About $500,000.
Yes. So if somebody is thinking to themselves, hey, I've got a fat 401k, or I've got a lot of money in my IRA, that's what's going to help me cover my long-term care costs or my medical expenses. Great, but you better make sure and do the math, because every dollar that you take out in an IRA, 30 or 40 cents is going to go off to the tax guy, depending upon what state you live in, right? So that's why this, number of 315,000. And later in the presentation, I'll get to how this is a very realistic number. This is the average. Some people spend a lot more, a lot of people spend a lot less, but this is the average. And I will tell you, after 25 years of working with people in their retirement years, this is not totally off base. And Justin, that we've had clients, guys like Jerry, that spent $750,000 in their healthcare years, right?
Yeah, a lot of money. And back to the last slide of preparedness, like I know in my family, heart attack or heart issues are an issue in my family. So it's definitely something, as I'm starting to age, that I'm starting to pay a little bit more attention to. And by that, I mean just at least talking to my doctors, as well as just being out and exercising a little bit more.
Well, and that's where that family history comes in, so
Yeah.
same thing with me. Like, I look at my history, and there's history of dementia, Parkinson's, things of that nature. And if you have a family history of Parkinson's, dementia, stroke, those tend to be the things that put people in board and cares, or put them into some type of assisted care for multiple months, if not multiple years. And that's where it can get really expensive. Thank God we're like on a heart issue. You might just, go in your sleep.
It's quick.
If you're lucky, you'll just go in your sleep. I mean, I can come over and smother you, but so,
Well, let's save that a few more years.
yeah, we'll wait till you're older. We'll let you get to your 50s first. So, what are your options when you're doing healthcare planning? So the big thing is everybody has to make decisions around Medicare. So we're going to talk about that today. If you're coming up to that Medicare age, what are all these things about Medicare? What are parts A through D, and should you do a Medicare Advantage plan or a supplement plan? So we'll talk a little bit about that. and what the difference is between a Medicare Supplement and Medigap plan versus like Medicare Plan C, or what they call the Medicare Advantage plan. Other options that people have, if you're still working, you might have your employee plan. Now, the reason I put this in like light, we're not going to talk about that today. That like if you have questions like, hey, I may work to age 70 and my employer provides me my health care. How do I defer Plan B of Medicare? That won't be covered in today's conversation. We'll do that as a separate video. And because that is something that people can do is as they're approaching Medicare age, if they're employed, they can defer out Part B. And we'll talk a little more about that in a future slide.
Yeah, and I would just add that if you do feel like you're going to be in a situation like that, feel free to reach out to us so we can give you a little bit more information on what he's kind of getting at. Because there is some, additional things that kind of come along with that need to be in place for some of that to happen.
Yes, exactly. So then right towards the end, we're going to talk about some little life hacks that include things like health savings accounts, Roth IRAs, and also ways that you can utilize long-term care to cover some of the costs that you may incur as you get deeper into your retirement years. There's a few little tricks that we have that you can utilize things like health savings accounts, Roth IRAs, other types of programs that can help you essentially bucket out your expenses of healthcare over time. And we're going to talk about that right towards the tail end of the presentation. So, Justin, the basics of Medicare. Now, Medicare is one of those things that can be very confusing. And if you're already on Medicare, the next 2 or 3 slides may be a little bit of a snoozer to you. But if you're approaching Medicare age and you're wondering, hey, how do I enroll? What are all these different things? That's what we're going to discuss right here. So as part of Medicare, you get Part A, which is what is called your inpatient insurance. So Part A covers anything that would be an expense when you go into the hospital, whereas Part B is what they call your outpatient insurance. It essentially covers all of your outpatient services like doctor's appointments, lab tests, that kind of stuff. And the premium of Part B comes out of your Social Security payment. And we'll get into that in the next slide. You have Part C of Medicare, which is often called Medicare Advantage. Now, this is where you have a private plan. So it could be a company like Aetna or Humana, that they are subsidized by the government to provide you a package of insurance services that basically replace Part A and B, help fill some of the gaps that A and B have, and allow you to have a full package with a little more services than you would if you just had what they call regular Medicare, which is just Parts A and B. And then they have—
And really quick.
Yeah, go ahead.
Oh, yeah, really quick before you move on to D, and maybe to help with some of these folks who are potentially reaching this age. So if you are coming up to this age and you do sign up for parts, Medicare for A and B, and you also want to do an Advantage plan, do you end up having to pay for both, correct?
Yeah, I'm gonna get it. That'll be on the next
Okay.
slide. We have where we break down the costs.
Yeah.
So yes, there could be, like, each one of these will break down the individual costs.
Okay.
And then outside of Part C, you have Part D, which is essentially a private prescription drug coverage. So you can add Part D to Parts A and B if you want to make sure that a lot of your prescription costs are covered or reduced, whatever it may be. And there's all kinds of rules into these things, and you've got to definitely do your homework prior to age 65. So when you hit 64, because enrollment period is 3 months before plus the month of your birthday, and then 3 months after your 65th birthday. So basically, when you hit age 64, that's when you want to be reaching out to us or somebody that has a specialty in Medicare to be figuring out what your options are. So I think, Justin, this slide right here,
Oh,
is where we
yes.
get into what you were talking about, is like, what are these costs that are associated with Medicare, and how do we get to that number that we just shared with everybody that said, hey, you might need 300, $400,000 in retirement for your healthcare needs, right? So part of that is your premiums for Medicare. It's not free. Part A, which is the inpatient hospital part, there's not a charge for it if you're eligible. Now, eligibility means that you basically paid into the payroll system, the US payroll system, for 10 years. It's very similar to getting the maximum earnings on your Social Security, where they look back over 40 quarters or basically 10 years. So if you worked in the US or you contributed to a payroll system that paid into the US tax system for 10 years or more, chances are you're eligible for Part A. Now, there's a misnomer a lot of times, because I hear this from clients all the time when I say, hey, what kind of money have you saved for Medicare medical costs? And they go, I don't need any. I got Medicare. It covers everything. And it doesn't, because everything has its limits in the world of insurance. Even the government has its limits. So, like, for instance, in Part A, what a lot of times people forget about is you have a $1,600 inpatient deductible, meaning that if you go into the hospital and let's say you're there for 20, 30 days, there's a per day fee. Well, that first $1,600 comes out of your pocket. And then after that, Medicare Part A starts to pay for the rest. And that's per 60 days. So it's not an annual thing. It rolls every 60 days. So if you're in the hospital for 70 days, you may incur this deductible potentially twice. The other thing that people forget is a lot of times, if you have had a serious medical condition, let's say you have a stroke or something of that nature, you may need to go into a skilled nursing facility for a period of time. And while Medicare will cover the first handful of days, usually like up to 20 days or so, once you start getting beyond that, you could have a per day cost for that skilled nursing. So even though Medicare covers a lot of things, when you get into some of these extreme situations, you may find that it doesn't cover everything and you end up getting a bill during a stressful time. So Part B, now the outpatient part, this year it's running right about $174 a month for most people. There's some exceptions to this. If you're a high wage income, there's a different scale if you have a certain income over certain areas. But for most people that we talk to, Part B is about $174 a month. It gets deducted from your Social Security payment. And what you have to think about Part B is that you have a $240 annual deductible, meaning that every year the $240 basically comes out of your pocket. And then after that, it's an 80-20 split. So even on Part B, you have this 20% copay. So when we get into this conversation about, hey, do I take Medicare Advantage Part C or a supplement plan, you have to think about, and we'll recircle back to this conversation, which is, hey, how could this copay affect my long-term expenses? So that's something to keep in mind. So Justin, before I go on to Plan C, any questions you have or anything you want to add to that?
No, just that 80-20 thing can add up that 20% could add up pretty quick if you need some sort of, outpatient like surgery or something like that. It could, yeah.
Yeah, if
Just
you have a lot of dates with doctors, it can add up.
yeah.
Yes. Yeah. If you're in the business of dating doctors via Medicare, it can catch up to you.
And I know we'll get into, and I don't want to get too ahead of myself because I know both you and I have some family experience that people that have already, that family wise, that are already in A and B, have actually been pretty happy with what's gone on. So don't automatically assume that Part A and Part B are just the bottom of the barrel.
Yeah, no,
So yeah.
it services a lot of needs. I mean, they've really built this well for people. Um, so let's say you are looking and you do your homework on part A and B, and you realize, hey, there's so many little gaps in here that I could see where I get little nickeled and dimed. Then you can look at part C, or what they call Medicare Advantage, because what that is that's basically a package plan that can be offered by another provider. Like I mentioned, Aetna is one of the providers, Humira, there's quite a few of them out there. And Part C can cost anywhere from nothing to up to $200 a month. And it can include Part D, which is the prescription plan. Most people that are doing Part Ds, when I kind of searched out what's the average cost per month, it's about $59 a month. So that's the thing to look at is, hey, if your Part C has a very low premium or low cost, and it includes Part D, it may not be such a bad deal. And like you were saying, Justin, we know quite a few people who've used Part C, and we'll get in the next slide. We'll talk about some of the advantages and disadvantages of that. But all these things work very well. It's doing the homework on what your needs are. So if you
Yeah, and
want
I
to
would
compare that, go ahead.
Oh, I was just going to say, and with Part D, what you want to do, at least in my research, is that if you are an individual that has a kind of a list of medications that you're taking,
Yeah.
when you go sign up, if you are going to sign up for a Part D plan, you want to go and say, okay, here's my list. Which plan does out of my list, which plan covers most of that? And that's kind of what you want to look for. Don't just go pick one and assume that it's going to cover all of the medications that you could be taking signing up for this.
Yeah, a lot about Medicare planning is doing your homework on what doctors you have, what medications you have, are they provided in these different programs. So if you're somebody who's saying, okay, do I do part A and B or do I do part C, or do I do part A and B and buy what's called a supplement plan? Then the thing to think about is the average Medicare supplement plan, or what they call a Medigap plan. Now, this is where you can purchase it this is where you could do parts A and B and then add a supplement plan rather than doing Part C. What you have to understand is that most of those Medicare supplement plans, if you do what is like the premier tier, like what they call Plan G, right now it's about $130 to $140 a month for somebody who's around 65 years old. So if you're putting all this together, like if you're saying, okay, Colby, simplify all this, what it means is that if you're somebody that if you're coming up to Medicare age, you should expect that your Medicare is going to cost you somewhere between $200 to $250 a month if you just do regular Medicare Part A and B or Medicare Advantage. You should expect it to be somewhere around in that range. If you want to do part A and B and add a supplement plan, so you have really extra layers of service and things of that nature, then you should expect that you're probably going to be paying closer to about $300 a month. So what do you get for that? So that's the question is what do you get for those differences? When you look at Medicare Supplement, when you're trying to compare, hey, do I do Medicare Supplement plan or do I do Medicare Advantage? The one big question to ask is, what's your level of care? And would that 20% deductible that Medicare has be cost prohibitive? Because then you might be looking at a Medicare Advantage plan or a supplement to add to regular Medicare. The other thing to think about is the biggest advantage on Plan C is all the added services that it provides. So one thing that some Plan Cs can also include is things like vision and hearing, possibly even dental. Whereas just buying a supplement plan, doing parts A and B and buying a supplement plan is probably not going to include your vision and hearing unless the supplement plan is including that in there. The biggest disadvantage to Plan C is that you're in a captive network. So Plan C, the Medicare Advantage, think of it like a HMO or a PPO where you have this network of service providers. So if you decide that you want to go with Medicare Advantage or Plan C, you got to make sure that the doctors that you have and the prescriptions that you have, like Justin was saying earlier, are included in the plan. Because if not, then you may end up having, a heck of a hard time getting your services that you need as you're in your retirement years. Bottom line is this: if you have complex medical needs, like if you have a lot of doctors or specialists, then you might want to just consider doing parts A and B and getting a supplement plan. If you look at Medicare Advantage or Plan C, and you can see that all your services can be provided there and your doctors are available there, then that might be the best way for you to go. So that's usually kind of the crossroads everybody finds themselves at. And the big thing to remember is that if you start with Medicare Advantage, Plan C, and you want to switch back, let's say you're in Plan C and you don't like living within that network, and you want to go back to just having Medicare Part A and B, and you want to buy a supplement plan, well, if you do that too late after age 65, you could be subject to medical underwriting for that supplement plan. See, what happens is when you're hitting age 65, you got an open enrollment period. And during that time frame, the supplement plans will automatically approve you. You don't have to go through medical underwriting. But let's say you do Medicare Advantage Plan C, and you do it for 3 or 4 years, and now you're 68, 69 years old, and you don't like it, and you want to go back to regular Medicare and add a supplement plan. Well, if your health has changed, that medical underwriting might work against you at that time. So if you're at that crossroads and you're trying to figure out how to straddle the fence, then it's probably better off that you start off with Part A and B, buy a supplement plan to fill the gaps, and then at a later date, you could always switch over to Medicare Advantage in that next open enrollment period. So just something to think about. Anything you want to add to that, Justin?
I did want to add too that there is for like if you delay your enrollment to kind of go back to D, you could, and I know that this applies for some things, but specifically if you delay your enrollment for Medicare Part D, you could incur a lifelong penalty by waiting too. So there is, and that can happen in a few other cases as well. I don't want to get too deep in the weeds, but doing your homework, like we said, being prepared can really make a big difference, because there could be some penalties that you're unwanted or unknowing just by signing up or not doing something the proper way. So just be careful and make sure you do your homework.
When you bring up a good point, because one thing we hear a lot of is we hear people say, oh, as they're approaching 65, they go, you know what, I'm not even gonna apply for Medicare because I don't plan on taking Social Security until I'm 70. They're not related, they're independent things. Everything around Medicare is 65. If you don't make some action around age 65, you're going to cause yourself all kinds of pain and suffering, because think of it like any insurance. As you age and your health gets worse, it gets more expensive. Medicare is no different. So at age 65, they're giving everybody a window of time where they're not asking any questions. If you wait till later, they're going to be asking questions, and it's going to be a problem. So just, think of it like any logical way you would think of insurance. Don't delay. If they give you a window of time around 65 and it gives you the best deal in the world, take it. If you're working and your employer is providing you insurance, then there are things that you could do to defer Plan B and not have a penalty. But get together with us so we can walk you through the right way to do that so you don't have a problem.
Yeah.
All right. So, at the end of the day, we covered most of these things as far as what questions to ask when you're trying to decide what Medicare program you want to be on. The one thing we didn't cover is really this, is that at the end of the day, one thing that does matter is what if you move? What if you move out of state? What if you travel a lot out of the country? Because Medicare is different a little bit by state by state. For instance, there's 4 states, California isn't one of them, that there's 4 states though that would not make you do medical underwriting if you didn't take a supplement plan during that open enrollment at age 65. There are some states, there's only 4, but there are some states that have basically like a guaranteed underwriting for those situations. So if you're planning, if you're one of those people who says, hey, when I retire, I'm selling my house in California and I'm moving to such and such state, you want to do a little bit of homework on what are the rules for Medicare in that state? How is it different, if it's different, and in what ways? So that's part of that pre-planning, is knowing that, hey, if you're going to retire in a different state, then do some homework on how that state handles Medicare.
And then I would say that the travel thing is quite important, because I know a lot of our clients, especially after they retired, loved travel. So that's I know you wanted to touch a little bit on, being able to have your
Yeah.
medical costs covered.
Yeah, well, at first I thought, it's funny. At first, when I did my first homework on that subject, Justin, I was I was getting the impression that if you travel out of country a lot, that you would be better off having a supplement plan rather than being on Medicare Advantage. And after talking to some people that are specialists in this area, that's that do this every day, all day long, they said, no, actually, if you're traveling a lot or traveling out of the country, you're probably better off on the Medicare Advantage. And I didn't dig deeper on why that was, but I went into that homework thinking that you would be better off with a supplement plan, but that didn't turn out to be the case.
Hmm.
So, earlier, let's just remind everybody that earlier we talked about the expenses of healthcare in retirement. So how do you get there? Seriously, Colby, how are you serious? People need 3, 4, 500,000. Well, hey, when you look at a hospital stay for one night can be $4,000 to $6,000. And then you look at that, a lot of people, if they have a diabetes medicine, sometimes they have a heart medicine, sometimes they have a nerve pain, all of a sudden you start adding all these prescriptions, and you could be spending 500, 600, 700 bucks a month on prescriptions. God forbid you get something that you need Skyrizi for, which is,
Yeah.
plaque psoriasis. Forget about it. I mean, if you had got psoriasis and you needed some Skyrizi, you're going to cough up $14,000 for the treatment. But the big thing that most of the people are going to have to really realize is that it's really the cost of long-term care that gets you. It's the skilled nursing, because Medicare doesn't cover things like that. So as an example, is we have a very good client that had a very bad stroke in November. Now he's coming out of a skilled nursing facility and is going into a board and care facility, because now his Medicare payments for the skilled nursing are running out. So he's reached his maximum time, and so now he has to move out, but he's not ready to go home yet. His wife can't take care of him. He still has a G tube, which is for his feeding. So if you need skilled nursing, or you need to go into a long-term care like a board and care, very easily could be anywhere from no less than $6,000 a month all the way up to 13,000. And if it's a couple, you could double that. So those are the things that end up getting people. And if you've got $1 million in your investments and in your savings, then by all means. But if you're somebody who's in your 50s, you really should be considering long-term care insurance. If you're watching this and you're in your 70s or 80s, you should be forwarding this to your kids or to your friends that are in their 50s and say, hey, listen, just do the simple math. If the average couple may need 500,000 in healthcare, and if you think about it, if you're 55 to 60 years old and the average long-term care premium is, let's say, $250 to $300 a month, so let's call it $3,000 a year. How many years of $3,000 a year would you have to string together to add up to $500,000? I mean, it's hundreds of years. So a lot of people are like, oh, I don't want to buy long-term care because the premium is expensive. Now, if you do it in your mid 50s, that's what it's designed for. And it makes sense at that point. So, what if you weren't? Like, the bottom line is that unless you plan on being incredibly riskless with your life, just take all kinds of risk and start smoking and drinking a lot, healthcare is going to be expensive. So what are the little hacks that you can do? If you're already retired, if you're approaching retirement, what are some of the things you can think about utilizing? So one of the things you want to do is make sure that every asset that you have in your retirement, your 401k, your IRA is working towards a goal. One thing that we teach people is how to bucket their savings so you can address the investment time horizon of that savings for each bucket based on when you think you're going to use that money. So you can bucket out your savings and investment process to make sure everything's working towards a goal based on a certain time frame, whether that goal is 3 years away, 10 years away, whatever it may be. If you have an old 401k, that can be really handy for future expenses, because an old 401k, I'll show you in the next slide, can be utilized for things like a Roth conversion or a health savings account, because both health savings accounts and Roth IRAs have some tax advantages if the money is used for what they call qualified healthcare expenses. And I'll talk about that in a second. The big thing is you got to start early. So here again, if you're already 70, 80 years old, we're probably having the conversation too late. If you know somebody who's in their 50s or 60s, send them this information because they need to know it. And we need to get them started, because people in their 50s and 60s, over the last handful of years, call it 10, 15 years, the government has been adding all kinds of what they call catch-up provisions that allow you to add more to your IRA, add more to your health savings account when you're over the age of 50 or 55, to help you catch up and close the gap for these kinds of retirement expenses. So Justin, anything you got for there to add as we wrap it up?
Yeah, I mean, I would just say, since they've increased some of those, call it your 401k contribution. So, now we're at, $23,000 for the year. If you're over the age of 50, you can tack on another 7,000. So imagine you put 23,000 like you were doing, and then you stake the other 7 that you could put in there, and you put that into a health savings account at age 50 or 55, in 10 years. That's going to add up pretty quick. And I know we're going to get into some of the benefits of a health savings account right now. So, I mean, just with those increases by, again, saving like you were for your retirement, your 401k, by having those catch-up contributions and potentially using those contributions to maybe facilitate this at an early age, can be a good way to start.
Yeah, and here's for those who don't know what an HSA or health savings account is essentially like an IRA, where you can put money into this health savings account, you get a tax deduction, and then that money that's inside that account can grow tax deferred, just like an IRA. You don't have to worry about short-term capital gains or anything like that. So you can invest it to get it to grow. And then if the money is used for qualified medical expenses, you can take the money out of the HSA plan tax-free. So one of the things that we teach people to do is, if they have an IRA or they have an old 401k, they can take that old 401k, and not on all, there's rules that we have to live by, but in a lot of cases, we can take that old 401k, move it into an IRA, which can then be transferred into an HSA plan, and that some of that money, up to the limit of $7 or $8 grand a year that they allow you, some of that money can then be used to invest for the future and utilized for expenses in that way. Roth IRAs have a neat little trick, because Roth IRAs do allow tax-free withdrawals for qualified medical expenses. Again, there's some rules around that, and I'm oversimplifying it, but at the end of the day, if you got an HSA plan or a Roth IRA or both, you've got some pretty powerful tools that can help you address some of these medical expenses later in life. especially if you are like wanting to take funds out without having to pay Uncle Sam. So we talked about how to use an old 401k to fund the HSA. The other thing to really utilize is Medicare supplement plans. And, that's, when you see how expensive everything is, you realize how important it is at age 65 to make that decision between a supplement plan or Medicare Advantage Plan C, that is really kind of the first decision that makes a lot of determination on how much you end up spending later on healthcare. And then,
Yeah, and I think a
yeah,
good thing to think about too is if you didn't sign up for, a long-term care policy like you mentioned, or a health savings account, and you didn't have a ton in retirement, the bills still, and you have a big medical expense, the bills still have to get paid. And where's that money gonna come from? And I know the last thing people want to do is start asking other family members to help them out when, hey, I'm right here at 65. Even if you're at 65, yes, starting earlier would have been better, but still important to think about where, was $250 a month all that much money? When now I have to go talk to, you know, my sister, my brother, or my kids.
it's a lot easier to come up with $250 a month to pay a long-term care premium than it is to come up with $12,000 a month when the need is when you're 80 years old or 85 years old. Now, let's say let's say you're watching this and you're saying, "Hey, great guys, but I'm already 80, I'm already 70. How do I long-term care plan now?" Well, that's where it is all about. What is your savings doing? What are your investments doing? How do that's where you have to then step back and say, within my liquid cash flow or within my investments, if I got multiple rental houses, do I end up selling one later? So there's a lot of ways that you can skin the healthcare planning cat here. You just have to then, if you don't have long-term care insurance, your long-term care planning becomes, okay, let me look at all of my assets and how do I optimize their growth and their income. So that way I can bucket out my healthcare needs. Hey, from age 70 to 75, I plan on spending X number of dollars. Let me budget that out now. When I'm 80 to 85, I might have more medical care needs. So I'm going to bucket out and set aside more money for that. And so if you bucket it, like I said, on time frames that are further out, because if you're 70 years old and you've bucketed money that you're going to use after the age of 85, that means you've got 15 years that money can work. Well, you can take a totally different investment risk with a 15-year time horizon than money that you might need to use in 3 or 4 years. So that's where it becomes really helpful for the people that are already retired. Is how do you long-term care plan is, hey, let's organize your investments and savings in a way so that you're mentally clear that if you hit this age and your expenses rise to this level, you've got it covered, right? Because at the end of the day, what insurance does, whether it's you're self-insuring yourself or you're having an insurance company do it, insurance is there to give you peace of mind. And so you can either do that through your own finances or through the use of an insurance company. So let's wrap it up. If you need so over the 20 odd years that we've been doing this, these are a couple resources that you can use that are really helpful in everything around that when it comes to healthcare planning. The website, A Place for Mom, is awesome. If you're trying to find a long-term care facility, an assisted care facility, you want to find a website that kind of has everything in one place, I highly recommend checking it out. They have a lot of good resources. Their newsletter is great. We have a good friend by the name of Kathy Gartner, who is a consultant. So if you're in a situation or you know somebody who needs to find a board and care facility, needs to find assisted care facility, Kathy is a consultant that knows all of them throughout Southern California. So rather than you driving around all town trying to pick out the right place, you can sit down with Kathy and she can say, hey, she can narrow it down for you, basically. Greg at Pacific Crest Financial is very helpful in helping us find some of the Medicare Supplement plans and healthcare programs. And then the AARP website, and the AARP just in general has some great information that is always free. So you can't knock them. If you can't knock them, you might as well join them, right? And at the end of it, hey, at the end of it, call us. When you got questions around any of this stuff, call us, because our whole goal is we don't sell healthcare insurance. We don't sell any of that, but we will refer you to somebody after we've heard what your needs are and we've done the analysis. That's the advantage with working with us, is that we're unbiased. We just do the analysis. We give you an answer that is best for you, and then we can point you in the direction of the experts that can help you fulfill the needs that you need from there.